There's a conversation happening in America right now, a conversation about mental health that's louder and more visible than ever before. But even as the stigma around mental illness begins to fade, there are still stories that remain hidden, truths that rarely make the headlines, and realities that are too often ignored. Nowhere is this more true than in the Black community. Today, we're pulling back the curtain on 5 shocking facts about Black mental health that no one talks about. These are the truths that shape lives, families, and futures, but are too often left out of the mainstream conversation. Let's start with the first fact. Black Americans are less likely to receive mental health treatment than any other racial or ethnic group in the United States. This isn't just a statistic, it's a crisis. According to the National Alliance on Mental Illness, only about 1 in 3 Black adults who need mental health care actually receive it. The reasons are complex: lack of access, lack of insurance, mistrust of the medical system, and the persistent stigma that surrounds mental illness in many Black families. But the result is the same. Too many people are suffering in silence, without the support or resources they need. Imagine what it feels like to carry the weight of anxiety, depression, or trauma, and to believe that you have to handle it all on your own. For many Black Americans, that's the reality. The message, whether spoken or unspoken, is often the same. Be strong. Don't show weakness. Keep it in the family. This culture of silence can be deadly. It means that symptoms go unrecognized, that people wait too long to seek help, and that when they do, they may not find providers who understand their experiences or their needs. But the barriers to care go deeper than stigma. There's a long history of mistrust between Black communities and the medical establishment, a history rooted in real harm. From the Tuskegee syphilis study to the forced sterilizations of Black women, the legacy of medical racism is not just a thing of the past. It shapes how Black people experience the healthcare system today. Many are understandably wary of doctors, therapists, and hospitals, fearing that they won't be believed, respected, or treated fairly. This mistrust is a rational response to a system that has too often failed to protect Black lives. The second shocking fact is that Black Americans are more likely to experience certain mental health challenges, but less likely to be diagnosed or treated. For example, Black adults are 20% more likely to report serious psychological distress than white adults, according to the U.S. Department of Health and Human Services. Black children are more likely to be exposed to trauma, violence, poverty, the loss of a parent than their white peers. Yet, when they show symptoms of depression or anxiety, they are less likely to be diagnosed and more likely to be punished or labeled as problem children. This is not just a failure of the mental health system. It's a failure of the entire society. Schools, police, and social services are often ill-equipped to recognize or respond to the mental health needs of Black children and families. Instead of receiving support, too many Black kids end up in the juvenile justice system, where their struggles are criminalized rather than treated. The result is a cycle of trauma and punishment that can last a lifetime. The third fact is perhaps the most shocking of all. Suicide rates among Black youth are rising faster than in any other group. According to the Centers for Disease Control and Prevention, suicide rates among Black children ages 5 to 12 are nearly twice as high as those of white children in the same age group. This is a crisis that few people are talking about. The reasons are complex: racism, bullying, social isolation, and the pressures of living in a society that too often devalues Black lives. But the impact is devastating. Families are left grieving, communities are searching for answers, and too many young lives are cut short. What makes this crisis even more heartbreaking is the lack of resources and support for Black youth. There are too few Black therapists, too few culturally competent mental health programs, and too little funding for prevention and intervention. Many families don't know where to turn, and when they do seek help, they may encounter providers who don't understand their culture, their experiences, or their pain. The fourth fact is that Black people are more likely to be misdiagnosed or underdiagnosed when they do seek mental health care. Studies have shown that Black patients are more likely to be diagnosed with schizophrenia and less likely to be diagnosed with mood disorders like depression or anxiety, even when they present with similar symptoms as white patients. This is not just a matter of bias, it's a matter of life and death. Misdiagnosis can lead to the wrong treatment, to unnecessary medication, to stigma, and to a sense of hopelessness. The reasons are complex. Some are rooted in stereotypes. Black people are often seen as more aggressive or dangerous, leading to harsher diagnoses. Others are rooted in a lack of cultural competence among providers who may not recognize the ways that depression, anxiety, or trauma can show up differently in Black patients. The result is a system that too often fails to see Black people as individuals with unique stories, strengths, and struggles.
The fifth shocking fact about Black mental health is that even when Black individuals do receive care, the quality of that care is often lower than what their white counterparts experience. This isn't just about access, it's about the experience within the system itself. Black patients are more likely to have their symptoms dismissed, their pain minimized, or their concerns ignored. They are less likely to be offered evidence-based treatments and more likely to be prescribed higher doses of medication or to be hospitalized involuntarily. The result is a deep sense of alienation and mistrust that can last for years or even a lifetime. This disparity in care is not just anecdotal, it's backed by research. Studies have shown that Black patients are less likely to receive psychotherapy and more likely to be treated with medication alone. They are less likely to be referred to specialists and more likely to be discharged from care prematurely. These patterns are not just the result of individual bias, they are built into the very structure of the mental health system. From the way insurance is handled, to the training of providers, to the allocation of resources, the system is stacked against Black patients at every turn. But the story doesn't end there. Despite all these barriers, Black communities have developed powerful ways to support mental health outside of the traditional system. Faith, family, and community have always been sources of strength and resilience. Churches, mosques, and other faith-based organizations often provide counseling, support groups, and a sense of belonging that can be life-saving. Barbershops and beauty salons serve as informal therapy spaces where people can talk openly about their struggles and get advice from trusted friends. These networks are not a substitute for professional care, but they are a vital part of the mental health landscape. There's also a growing movement to change the narrative around Black mental health. More Black therapists, psychologists, and social workers are entering the field, bringing with them a deep understanding of the unique challenges facing their communities. Organizations like Therapy for Black Girls, Black Men Heal, and the Boris Lawrence Henson Foundation are working to break the stigma, increase access, and provide culturally competent care. Social media has become a powerful tool for education and advocacy, with influencers and activists sharing their own stories and encouraging others to seek help. Still, the work is far from done. The mental health crisis in Black communities is not just a medical issue. It's a social, economic, and political one. Racism, poverty, violence, and trauma are all deeply intertwined with mental health. Addressing these issues requires more than just better therapy or more clinics. It requires systemic change. It means fighting for economic justice, for safe neighborhoods, for quality education, and for an end to discrimination in all its forms. It also means changing the way we talk about mental health. Too often the conversation is framed in terms of individual responsibility. Just get help, just talk to someone, just take your meds. But for many Black people, the barriers are not just personal, they are structural. It's not enough to tell people to seek help if the help isn't there or if it's not safe, welcoming, and effective. We need to build systems that recognize and address the unique needs of Black communities. One of the most important steps is increasing the number of Black mental health professionals. Representation matters not just for comfort, but for understanding. A therapist who shares your background is more likely to understand your experiences, your culture, and your pain. They are more likely to recognize the impact of racism, to validate your feelings, and to help you find strategies that work for you. But right now, only about 4% of psychologists in the US are Black, compared to 13% of the population. This gap is a major barrier to effective care. Another key step is making mental health care more affordable and accessible. This means expanding insurance coverage, increasing funding for community mental health centers, and supporting telehealth services that can reach people in underserved areas. It also means training all providers, regardless of their background, in cultural competence, so they can recognize and address the unique needs of Black patients. Education is critical too. We need to teach young people about mental health from an early age to break the stigma and silence. Schools should provide mental health education, counseling, and support, especially in communities that have been hardest hit by trauma and violence. Parents, teachers, and community leaders all have a role to play in creating environments where it's safe to talk about mental health, to ask for help, and to support one another. Finally, we need to listen to those who are most affected. Black people with lived experience of mental illness are the experts on what works and what doesn't. Their voices should be at the center of any effort to improve mental health care. Too often, policies are made without input from the people they are meant to serve. That has to change. The 5 shocking facts about Black mental health are not just statistics. They are stories, lived realities, and urgent calls to action. They reveal a system that is failing too many, but they also point the way forward. With courage, compassion, and commitment, we can build a future where mental health care is truly for everyone.
The conversation about Black mental health is finally starting to shift, but the journey is far from over. For generations, mental health was a taboo subject in many Black families. The idea of talking to a therapist, admitting to depression, or even naming anxiety was often met with skepticism or silence. Pray about it, tough it out, or we don't talk about that in this house were common refrains. This culture of silence didn't come from nowhere. It was a survival strategy, a way to cope in a world that was already hostile and unforgiving. But as the pressures of modern life mount, and as more people share their stories, the need for open, honest conversations about mental health has never been greater. Social media has played a huge role in breaking the silence. Platforms like Instagram, Twitter, and TikTok have become spaces where Black people can share their struggles, find community, and access resources. Hashtags like Black Mental Health Matters and Therapy for Black Girls have helped normalize the idea that it's okay to not be okay. Influencers, celebrities, and everyday people are using their platforms to talk openly about therapy, medication, and self-care. This visibility is powerful. It lets people know they're not alone, and it challenges the stigma that has kept so many silent for so long. But visibility is just the first step. The real work is in building systems of support that go beyond social media. That means creating safe spaces in schools, workplaces, and communities where people can talk about mental health without fear of judgment or retaliation. It means training teachers, coaches, and faith leaders to recognize the signs of mental distress and to respond with compassion and understanding. It means making sure that mental health resources are available, affordable, and culturally relevant. One of the most promising developments is the rise of peer support networks. These are groups where people with lived experience of mental illness come together to share their stories, offer advice, and support each other. Peer support is powerful because it's based on empathy and understanding. There's no need to explain or justify your feelings because everyone in the room has been there. For many Black people, peer support groups offer a sense of belonging and validation that is hard to find elsewhere. Faith communities continue to play a crucial role as well. For many, the church is still the first place they turn in times of crisis. Pastors, ministers, and church elders are often trusted confidants, and many churches now offer counseling, support groups, and mental health education. Some are even partnering with mental health professionals to provide services on site. This blending of faith and mental health care is helping to break down barriers and reach people who might never set foot in a therapist's office. At the same time, there's a growing recognition that self-care is not selfish. It's essential. For too long, Black people have been expected to carry the weight of the world on their shoulders, to be strong for everyone else, to put their own needs last. But the truth is, you can't pour from an empty cup. Taking time to rest, to recharge, to care for your mind and body is not a luxury. It's a necessity. This shift in mindset is helping to create a culture where it's okay to set boundaries, to say no, and to prioritize your own well-being. Still, there are challenges. The mental health system is not always welcoming or accessible. Long wait times, high costs, and a lack of culturally competent providers can make it hard to get the help you need. For those who do seek care, the experience can be frustrating or even re-traumatizing. Stories of being dismissed, misunderstood, or mistreated are all too common. This is why advocacy is so important. Pushing for policy changes, demanding better training for providers, and holding the system accountable for serving everyone, not just a privileged few. The impact of racism on mental health cannot be overstated. Microaggressions, discrimination, and the constant stress of navigating a world that sees you as other take a real toll on the mind and body. This is sometimes called weathering, the cumulative effect of chronic stress that leads to worse health outcomes over time. For Black people, the burden of racism is not just a social or political issue, it's a public health crisis. Addressing mental health in the Black community means addressing racism in all its forms. But there is hope. The resilience of Black communities is legendary. Despite centuries of oppression, Black people have found ways to survive, to thrive, and to create beauty and joy in the face of adversity. This resilience is not just about enduring pain. It's about finding meaning, building community, and imagining new possibilities. It's about turning struggle into strength and pain into purpose. The future of Black mental health depends on all of us. It depends on breaking the silence, challenging the stigma, and building systems of care that are truly inclusive. It depends on listening to those who have been marginalized and centering their voices in the conversation. It depends on recognizing that mental health is not just an individual issue, but a collective one, a matter of justice, equity, and human dignity.
The journey toward better Black mental health is not a straight line. It's a path filled with setbacks, breakthroughs, and moments of both pain and hope. For every story of someone finding the right therapist or support group, there's another story of someone who gave up after being dismissed or misunderstood. For every new initiative or resource, there are still too many people who fall through the cracks. But what's changing, slowly but surely, is the willingness to talk about these struggles openly and to demand better from the systems that are supposed to help. One of the most important shifts is the growing movement to redefine what healing looks like. For a long time, mental health care was seen as something private, almost secretive, a matter between you and your doctor, or maybe your family. But now, more people are recognizing that healing can be collective. It can happen in group therapy, in community gatherings, in art, music, and movement. It can happen in spaces where people share their stories, listen to each other, and realize they're not alone. This collective approach is especially powerful in Black communities, where the bonds of family, friendship, and faith have always been sources of strength. Art and creativity are playing a bigger role than ever. From poetry slams to open mic nights, from painting to dance, Black artists are using their talents to process pain, express joy, and build community. Art therapy programs are popping up in schools, community centers, and even prisons, offering new ways for people to heal. These creative outlets aren't just about self-expression, they're about survival. They give people a way to make sense of their experiences, to find meaning in the midst of chaos, and to connect with others who understand. Music, too, has always been a form of therapy in Black culture. Gospel, blues, jazz, hip-hop, these genres were born out of struggle, but they are also celebrations of life, love, and resilience. Listening to music, making music, dancing to music, these are all ways to cope with stress, to lift your spirits, and to feel connected to something bigger than yourself. In a world that often feels overwhelming, music is a reminder that you are not alone. Another important development is the rise of mental health advocacy led by people with lived experience. More and more, Black people who have struggled with mental illness are stepping forward to share their stories, to fight for better care, and to support others on their journey. These advocates are changing the conversation, challenging stereotypes, and pushing for policies that reflect the real needs of the community. Their voices are powerful because they come from a place of truth. They know what works, what doesn't, and what needs to change. Technology is also opening new doors. Teletherapy, mental health apps, and online support groups are making it easier for people to access care, especially in areas where resources are scarce. For Black people who may feel uncomfortable or unwelcome in traditional settings, these digital tools can be a lifeline. They offer privacy, convenience, and the chance to connect with providers who understand their culture and experiences. Of course, technology is not a cure-all. There are still issues of access, affordability, and quality, but it's a step in the right direction. Despite all these advances, there are still big challenges ahead. The mental health workforce is not nearly diverse enough, and many providers still lack the training to offer culturally competent care. Insurance companies often make it hard to get the help you need, and public funding for mental health services is still far too low. The criminal justice system continues to punish people for behaviors that are really symptoms of mental illness, especially in Black communities. And the ongoing impact of racism, poverty, and trauma means that the need for support is greater than ever. But there is reason to hope. Every time someone speaks up about their struggles, every time a new resource is created, every time a policy is changed, the stigma around Black mental health gets a little bit weaker. Every time a family has an honest conversation, every time a church hosts a mental health workshop, every time a young person learns that it's okay to ask for help, the future gets a little bit brighter. The most important thing to remember is that healing is possible. It may not look the same for everyone, and it may not happen overnight, but it is possible. With the right support, the right resources, and the right community, people can and do recover. They can find joy, purpose, and connection even after years of struggle. They can break the cycle of silence and shame and build a new legacy of openness, compassion, and strength. The 5 shocking facts about Black mental health are not just reasons for concern, they are calls to action. They remind us that there is still so much work to do, but also that change is possible. By talking about these issues, by supporting each other, and by demanding better from our systems, we can create a world where mental health is truly for everyone.